Tooth development. This presentation presents the induction of the tooth development. During tooth structure develops, it undergoes bud, cap, bell and crown stages. These stages are occurred due to the initiation, morphodifferentiation, histodifferentiation and hard tissue formation on particular tooth developing tissues. And above all processes take place due to the cellular interaction, cellular proliferation, cellular differentiation, apoptosis and mineralization. So, what we need to know about all these stages, processes and activities are when, where, how these take place. Then we will see what is differentiation. It is a transformation of cells into different structural and functional characteristics. Then we will see the morphodifferentiation and histodifferentiation. The morphodifferentiation is the change of the morphology of a particular structure with its functional characteristics. And the histodifferentiation is the change of the histology of a particular structure with its functional characteristics. Then about the induction. It is the process that initiates the differentiation of a particular tissue that causes due to the influence coming from the another tissue, causing the latter to change into a different functional characteristics. And it is called induction. Then we will see how these ectomesenchymal cells are formed. And during the cranial neural tube formation, then these cranial neural crest cells are derived from cranial ectoderm. And these neural crest cells migrate into the primitive oral cavity region and mix with the mesenchymal cells. Primitive oral cavity is a cavity lined by a first branchial arch epithelium, ectoderm, and it is lined by a primitive 2 to 3 cell thick layered epithelium. It is surrounded by mesodermal cells. Then with time, neural crest cells migrate from the cranial region into the primitive oral cavity region. Once they mix with the mesodermal cells, we call this mesoderm ectomesenchyme. The cells that are located in this mesenchyme we call ectomesenchymal cells. And this ectomesenchyme is an embryonic connective tissue that consists of a few spindle-shaped cells with gelatinous ground substance. Therefore, the tissue forming oral ectoderm, in other words odontogenic epithelium, develops from first branchial arch, and it is essential to produce teeth, and it has initiation factors like molecules or genes that are needed to produce teeth, and it produces specific growth factors or signaling molecules at places where teeth are supposed to be. For example, expression of fibroblast growth factor. FGF8 induces homeobox genes in the ectomesenchyme to continue the induction. Therefore, during induction, the initiation factors that are located in the oral ectoderm provide the odontogenic potentiality to the oral epithelium, and it initiates the odontogenesis by influencing or inducing the underlying ectomesenchyme, and thereby at 6-week intrauterine life they get the odontogenic potentiality, and then after the factors that are isolated in the ectomesenchyme maintains the tooth tissue formation by inducing and maintaining the formation of the epithelial structure. Therefore, at this stage, tooth-forming tissues express inductions which we call reciprocal induction, as tooth tissues are reversely induced. These particular tissues to form the tooth structure. As a result, at 6-week intrauterine life, in the primitive oral cavity, there's a formation of a continuous band of thickened epithelium which is in horseshoe shape in presumptive upper and lower jaws in correspond to the future dental arches. This primary epithelial band is formed due to proliferative activity, which is said not so much of increase, but it is due to a change in orientation of the mitotic spindle and the cleavage plane of dividing cells. So here you can see how it is formed. Then the primary epithelium band soon divides into two laminae, dental lamina and the vestibular lamina. Dental lamina is located lingually and vestibular lamina is located buccally. And these two laminae express the future developing tooth structure and the vestibule. In this corona section of an embryo, you can nicely see the developing dental lamina and vestibular lamina. Then we'll see the fate of the vestibular lamina. At the beginning, it continues its proliferation and its enlargement. With that, it starts to degenerate. Once it starts to degenerate, it forms a cleft between cheek and the tooth bearing area, which is called vestibule. About the dental lamina. Dental lamina start its proliferation continuously in isolated areas, and thereby it form a series of epithelial outgrowths. And these outgrowths are surrounded by accumulated ectomesenchymal cells, and these two tissues together form the tooth forming structure which we call tooth germ that give rise to the future tooth. This histological section shows the developing tooth germ. which consist of epithelial bud and condensated ectomesenchymal cells, and this structure is attached to the epithelium via dental lamina. Thereby finally these developed tooth germ undergo different stages to give rise to the future tooth.